do a little bit about mock code, okay? So when you come in for mock code, you're going to be here in simulation again with me. And I want you to use the monitor, okay? So when you use the monitor, again, you're going to be using the oximeter. We don't have cardiac leads, but you remember how to place the patient on the monitor. You just touch where it says touch. Go ahead and start it. You are also, you're just going to touch where it says touch. Then I'm going to take a blood pressure using the monitor, so I'm going to hit start. I'm going to start talking to my patient, do my assessment. When I notice that something's wrong, I got lots of things that I can do, right? I can call the doctor. I can get some help in here. I can continue with my assessment. Okay? Remember that suction is up here. There's gloves. There's an ambu bag. There's oxygen. Okay? Let's take a look at our crash cart. Crash cart's going to be located right in here, so you don't have to be nervous and feel like you're going to have to run out into the other lab for that. So the first drawer has syringes in it, alcohol, 2x2s, flushes, needles. Okay. The second drawer has defibrillator supplies. There's also a portable defibrillator right up there. Medications are located right here. These are emergency medications, just like you would use emergency medications. IV equipment, primary and secondary tubing, as well as IV bags. Respiratory equipment, we have nasal cannula, mask, endotracheal tubes, veni mask, a trach holder, another trach holder, a trumpet, an ET tube holder, all sorts of trachs. Fun stuff right there. And there'll also be a laryngoscope in here too. And then the bottom, there's a CVC kit in here, another ambu bag. This is an OG. And if you gotta have this put down, OG. Okay? This also has oxygen, and there's a backboard right there, okay? So, do you know how to run a code? Maybe. Are you going to be in charge of running the code? No. Somebody else will be in charge of the code. Who will be in charge of running the code? Either the doctor, nurse practitioner, PA, or nurse and supervisor. Okay? Do you know how to do CPR? You should. Every one of you is CPR certified. Do you know how to assist respirations? You definitely should. You should know how to use the ambu bag. You should know how to operate a flow meter. Do you know how to assess a patient? I hope so. Do you know how to administer medications? You should at this point. Do you know how to use PPE? Definitely. Do you know how to document a code? In a situation where everything is running at 100 miles an hour, a lot of times what people will use is a paper towel. It's my favorite method of documentation personally. But then I go back and I make it more formal. So I'm going to show you the form that we use and that we're going to use for our code. Okay? And that'll somehow start to get your level of anxiety down. If you're not coming to code or to simulation, if you're not coming to run a mock code this week, you are coming to complete a quiz, okay? So I want you to show up anyway. If you're coming for mock code, show up in your uniform. Yes, in your uniform, because I'm wearing my uniform. You should be wearing your uniform. And then if you're not running a code, you're going to take a quiz next door in 201. So bring your laptop, okay?